COVID-19 pandemic shed light on healthcare inequities facing some New Yorkers, and now advocates are hoping a single-payer healthcare program can help close the gap. Our Nick Reisman joins us now with more from the state capitol. Nick.
Susan, for years, state lawmakers here at the state capitol have introduced a bill that would essentially create a single-payer healthcare program in New York. But advocates say this year should be different because of the inequities opened up by the COVID-19 public health crisis. The pandemic has led to a public health crisis and an economic recession, affecting poor and low-income people disproportionately. Ursula Reisman says it's a sign New York needs a single-payer healthcare program.
The pandemic, the way I see it, really exposed a lot of the healthcare inequity that already existed. And the New York Health Act would remove the financial and insurance barriers that have kept people from taking care of their health.
Reisman is a Syracuse-based advocate with the Campaign for New York Health, a group backing the single-payer health care bill introduced earlier this month once again by Democratic state lawmakers. The bill would replace the current private health insurance system with a government-run program for all 19 million residents.
New Yorkers would never have to fear of losing their health insurance if they lose their job. They would never have to worry about being kicked off their insurance because of a change in income.
The proposal would cost billions of dollars, swell the size of the state budget, and would reorganize the healthcare sector in the state. Ginsburg of the New York State Business Council says linking the measure to the pandemic is misplaced.
People are getting the healthcare they need during the pandemic through a variety of federal and state laws, executive orders, programs, etc. People are not really charged with paying for that care.
About 95% of New Yorkers are currently covered by some form of health insurance. Ginsburg says there are ways to boost coverage without passing a single-payer bill.
There are a host of things that we can do to close that 5% gap and get to universal coverage. We all share that goal. We're talking about a really small chasm that we have to fill.
Supporters of the New York Health Act contend that ultimately this is a proposal that would save New Yorkers money on their health insurance in the long run. However, opponents point out that because this would essentially replace the state's private health insurance networks, that could cost potentially thousands of jobs. Susan?
So, Nick, we've heard these arguments for years now. What are the chances of the bill passing this year?
Well, I think it's fair to say that this is not on the agenda for the state budget, which is going to be due in the next couple of weeks, or I think that would be a shock to everybody here in the state capitol at this point. But it is important to point out that you have Democratic supermajorities right now in the state assembly, in the state senate. You have increasingly more lawmakers who are getting elected to the state legislature who are potentially in favor of some form of single-payer health care, if not at the state level, then at the federal level as well. You still have some Democrats who would have some serious questions about moving forward with a single-payer health care plan. That being said, it has been inching upwards in terms of support within the legislature itself. Governor Cuomo has said that he would support a plan on the federal level for single-payer health care.
Nick Reisman reports.